Welcome clients and guests to my YouTube channel. I'm Jason Cerro and I'm a licensed professional counselor. My videos are designed to educate and empower you to make informed decisions about your mental health. If you want to watch my latest videos, subscribe and be sure to hit the notification bell so you never miss a video. If you happen to like this video or learn something, be sure to give it a thumbs up because it really helps the channel. Mental health therapists are in high demand today, and it's always a good idea to look for high-quality professionals who can help guide us in being healthier versions of ourselves. While practicing as a therapist for several years, I have learned through work with clients and other professionals some fundamental qualities to look for when finding and working with a mental health clinician. This list is not meant to be the be-all end-all for finding a high-quality therapist, but it's at least a starting point that will allow you to make a fair assessment regarding your current therapist or a guide to follow if you're looking for one to work with. Number 1, is your therapist easy to talk to? The basic premise of therapy is to be able to confide our most intimate personal moments to another human being that are sometimes accompanied by feelings of shame and embarrassment. I couldn't imagine being able to tell someone something so intimate and personal if I didn't get the sense that they were calm and easy to speak with. If you are anxious and timid your first time going, that is certainly understandable. So a really good therapist will put you at ease as much as possible by warmly greeting you and even congratulating you for making that enormous leap to start therapy. A good therapist will oftentimes acknowledge every step of the way you took to get to that first meeting, such as deciding you want some help, making the first contact, and then following through with the first face-to-face session. Even as you're watching this video, I congratulate you for viewing and contemplating actually starting therapy. Speaking of viewing, please take a moment to subscribe and like the video if you haven't already. Spreading the word to others to get some guidance is absolutely paying it forward. Number 2, does your therapist seem to be judgmental? If you think so, take a closer look at your interactions with your therapist. I speak on this topic coming from a ROGERIAN perspective, otherwise known as person-centered therapy. Person-centered therapy was developed by Carl Rogers. At its core, Rogers believed that therapists should have unconditional positive regard for clients, even if our worldviews are drastically different, and even if we find their behavior to be morally offensive. It's an acceptance of where the client is at. The therapist meets you where you are and goes from there. Do you feel emotionally safe telling them something really difficult? Usually, if you feel your therapist is non-judgmental, you will feel emotionally safe telling them something that is stressful. There is often contemplation in clients' minds prior to disclosing, but ultimately you will know that your therapist will be accepting of your thoughts, feelings, and actions. You'll know your therapist has judgmental views if they tell you what you should be doing, especially if it's something pertaining to leaving your partner. The only time I can ever recall helping someone leave their partner was a domestic violence case where me and the client came up with our exit safety plan. Unless it's a dangerous situation, therapists should tread very lightly on sharing their unsolicited views. For me, this topic blends into whether or not a therapist should give their clients advice. It's a complex issue, and I don't think there is just one way to handle it. On one hand, when a client is looking for advice, they may genuinely be looking for guidance, and usually it's to validate what they're already thinking. Giving advice centered around the client's goals is appropriate. For example, a client may say, "I just don't know what direction to go in life right now. What do you think I should be doing?" A good therapist will redirect the client to what options the client probably stated previously. For example, the therapist may answer with, "Well, I know you talked about possibly either going back to college or finding a trade school. Are those options still on the table?" This allows the client to continue processing what their goals and values are, so they can continue making choices that best fit their situation. A quality therapist listens closely to your words and ideas and helps guide, not insisting on pushing their own agenda for you. Number 3, Is your therapist consistent and dependable? Do they schedule appointments and pull no-shows or cancel at the last minute? Naturally, things happen and sessions sometimes have to be rescheduled or canceled due to unforeseen incidents. However, and it's a big however, if this seems to be a trend where they are calling or texting last minute or just plain canceling appointments more than a time or two, you most likely do not have a reliable therapist. How can you expect to share your most intimate personal details with someone you can't really count on to show up? A good therapist will acknowledge the cancellation, apologize, and maybe give a line or two about addressing the difficult time a client may be going through, and how it will be discussed as soon as possible. For example, a cognizant therapist may say something like this: "I am so sorry for having to cancel our appointment this week. I know you have worked so hard at managing your panic attacks, and I'm looking forward to seeing your continued progress. Would you like to schedule an appointment later this week or completely skip this week and continue our therapy on your regularly scheduled day?" These simple acknowledgments are evidence that the therapist values the therapeutic work and relationship. This also builds trust and accountability because therapy truly is a partnership that needs to continually grow and evolve in order for it to be effective. Number 4, is your therapist an expert on the presenting problem? Counter to the ROGERIAN perspective, where the therapist and client operate on the same level, it's still very important that your therapist has a great deal of expertise, experience, and education regarding the issues that brought you into therapy. This is especially important for conditions like obsessive-compulsive disorder, OCD, eating disorders, and substance abuse, to name a few. Interview the therapist by asking what their credentials, education, and experience is. Clinicians have all sorts of different work and education experiences and letters after their name, and it's virtually impossible to understand what those letters are after their name and what they really mean. Ask them directly what experience they have and what therapeutic model they use. Not only that, ask them to provide an example of how they would work with either you or your child. For example, if you know you're struggling with OCD, ask the therapist how they can help you. A quality therapist will tell you the approach or approaches they use and what to typically expect. They may say something like, "I use cognitive behavioral therapy, CBT, to identify the distorted and irrational thinking you may be having, along with exposure therapy. With exposure therapy, we will slowly and gradually confront your irrational fears so that you develop more confidence and tolerance and do less avoidance." Your therapist is a valuable resource, so utilize them to the max. Ask them questions, and if they don't know something, it's their job to point you in a direction that will help you. Number 5, does your therapist do actual therapy? Most of us have friends. We don't need our therapist to be our friend. In fact, it's unethical if your therapist is behaving or suggesting you become friends. Most ethical guidelines state that a therapist cannot have a non-therapeutic relationship with a former client until at least 2 years has passed. If they're asking you to join them outside of the office for some unrelated reason or talking with you about things that aren't in your therapeutic treatment plan, please run to exit stage left.
Thank you.
Let's not confuse this with the very friendly, down-to-earth, and relatable therapist who has friend-like qualities. If that's the case, you have a really good therapist, as long as they are staying consistent with including therapy models and interventions. Let's remember, you came to therapy because you have some issues that you probably can't solve on your own, not to find another friend who chats about surface-level topics. If you're not feeling just a bit of discomfort, your therapist is probably not appropriately challenging or nudging you enough. So what is actual therapy? Your therapist has learned through education and clinical field experience therapeutic frameworks in which they base their questioning on. Probably the most common framework is cognitive behavioral therapy. Ideally, when you start talking about your concerns in therapy, the therapist responds, questions, and intervenes in alignment with the framework they choose to use. Sometimes therapists have an eclectic style, which means they incorporate multiple frameworks in their sessions with you. In most cases, your therapist should be transparent and upfront about what model or models they are using. The model should be evidence-based and have a lot of research behind it. Don't be afraid at all to ask them directly what guide they are using. These tidbits I'm providing you are the distinctions between actual therapy and just talk between two people. Number 6, do you and your therapist establish goals? Goals in therapy provide a path for healing. They serve as our compass. Establishing our end goal allows for us to walk down the right path, especially when we hit crossroads during treatment. In your first meeting with your therapist, and even throughout treatment, the therapist should ask you what you're trying to accomplish by being in therapy. What happens next depends on your answer. If you already know why you're in therapy, simply state your end goal. You may say something like, I'm pretty sure I'm having panic attacks because everyone around me is telling me that's what they are, and so I want to stop having panic attacks because they are terrifying. You may even realize through therapy that you have high anxiety and want to learn ways to better manage your overall stress. Perfect! Our goals are to learn ways to better manage our overall anxiety and ultimately eliminate panic attacks completely. That is your foundation, as talking points and therapeutic interventions will be aligned with your goals. For an intervention, your therapist may assign a thoughts and feelings tracking log to identify your cognitive distortions, along with you practicing at home grounding techniques to keep your emotions regulated. This is actual therapy, and once your goals are reached and executed, you at that point either establish new goals or you transition to ending therapy for the time being. If you don't know why you're in therapy, or know what goals to establish, or are just there because others have suggested you go, it's a great opportunity to get curious about your life and explore with your therapist all of those factors. A quality therapist will help you figure out what you may be struggling with or want to improve on. It can sometimes take a session or two to figure the goals out. If you found this video useful, please like it and share it to someone you believe it may help. Please subscribe if you haven't already, and don't forget to put the notification bell on so you know exactly when my next video comes out. Thank you for watching, and as always, be where you are, be resilient.